Yep, it's recording.
Okay. Thank you, everybody, and welcome to this video conference where we will listen to Melissa Sharp with her presentation of her completed PhD thesis. As we have been instructed by the University of Paris, we're supposed to check that all the members of the jury are here, and we did this. The list goes on from Professor Adrian Polashek, that's me, Professor Jörg Merpel from University Medical Center Freiburg, Professor Darko Hren, also from University of Split, Professor Isabelle Boutron, I'm sorry for some kind of mispronunciation of your names, Université de Paris, Eric von Elm from University of Lausanne, Professor Mariam Bakker from University of Tilburg, Professor Penny Whiting from University of Bristol, and Professor Marie Zins from University of Paris. We also have several members of the audience who are here with us, and what we'd like you to do is to present your results in 30 to 45 minutes. And after this process, we will ask questions, and then we will split into a separate video conference where we will discuss all that you've shown to us, and afterwards we will come back with a decision. So if it's fine by you, please take on and show us the results of your thesis.
Okay, perfect. So thank you everyone for joining today. Since there's a lot to cover, I'll sort of get started right away and talk about my PhD, which focuses on the use of reporting guidelines as an educational intervention for teaching research methods and writing. So to start off with, if my slide wants to progress, I will start with an overview of what I'll be talking about today. So starting off with a brief introduction about reporting guidelines, what they are, talking about observational studies and the reporting guideline for observational studies, which is called STROBE. That's the one that I focused on. And then I'll talk about the overall approach that I used for my thesis, and then talk about each of the projects that I did for it, not going into deep detail of it, but giving a broad overview of them, and then ending up with my final proposal for my educational intervention. So to start off with, reporting guidelines were created because poor reporting of biomedical research is a persistent and a prominent problem. It has been for many decades, and this is across many different scientific fields. And study results, they're failed to be reproduced and replicated, and oftentimes this is simply because there's missing information from the study report, which is often in the form of a journal article. And so when you don't have that information, you're not really able to judge sort of the quality of the work, how generalizable it is, and you're not really able to use that information to inform health policies or clinical care. So in order to try to fix this and to reduce research waste, reporting guidelines were created. The movement started in the 1990s. Sort of the first one that's really recognized is CONSORT, which is for clinical trials. And since then, this sort of industry has rapidly expanded. So there are many reporting guidelines for different study designs and fields. So the one that I focus on is for observational research. It's very useful, it's cool, it's hip, it's diverse, and it covers cross-sectional studies, case control studies, and cohort studies. The benefit of observational research is you can often follow larger groups of people for longer periods of time for less money. So it's very good and very useful. But unlike clinical trials, randomized clinical trials, you're not able to really control for certain things, and there's a lot of biases that are particular to observational research. So it's really important to have some sort of methodological guidance for these types of studies. So recognizing this, STROBE was created in 2007. It provides guidance on how to report the results of cross-sectional case control and cohort studies. It's comprised of a 22-item checklist and an accompanying elaboration, explanation, and elaboration document, or E&E. This E&E sort of takes each checklist item, explains why it's important, gives more information about it and education about it, and then gives an example from a real research article that authors can sort of model their work after if they would like. And it's seen quite a lot of success. It's been endorsed by the International Committee of Medical Journal Editors, ICMJE, and it's been endorsed by many journals, and it's sort of spawned at least 15 or 16 different extensions since its creation for specialized fields or methods like nutritional epidemiology or response-driven sampling. So before jumping into things and creating this educational intervention, I needed to understand the literature that was out there. And it was pretty immediately apparent that a majority of the work that's on reporting guidelines, they focus on CONSORT, which is for clinical trials, and on PRISMA for systematic reviews. While there are a widespread sort of, low endorsement rates, we always would like them to be better. STROBE is endorsed at much lower rates than those two. And there's less evidence surrounding STROBE. It's also unclear on the evidence of impact, meaning that whether a journal's endorsement impacts the quality of the reporting, the completeness of the reporting. The evidence on that is still needs to be developed. And also there's some resistance from journal editors saying that they don't want to promote or enforce reporting guidelines, and they say things like they don't want to enforce a strict requirement for authors because they might go to a journal that doesn't have this requirement, but no one has actually asked authors if that is the case. If someone asked them, would they just say, okay, it's not worth it? And no one has asked them sort of how they currently interact with STROBE and what they think about it. So really the end user's perspective is missing on this. So to try to fill in some of these gaps, I use this approach called the Promoting Action on Research Implementation in Health Services Knowledge Translation Strategy, or the PARIS framework, shorthand. And this proposes that for any successful research implementation, you must sort of have three different aspects that work together. First, you must have strong evidence. So in this case, that's STROBE's effectiveness and acceptability by the research community, that the evidence for that is strong. Second, that the culture, the leadership roles, and the organizational structures support the use of STROBE, so the context is supportive. And lastly, that authors hold the personal characteristics that facilitate the use of STROBE. And so the way that I split this up for my project, or for my PhD, was I did two main projects with some subparts. So the first one looked at the evidence of the acceptability of STROBE as sort of a methodological base to base this educational intervention off of. The context, the second part of the first project looked at sort of the more objective on-paper endorsement rates of the academic publishing, if that was supportive, whereas the second project looked at the author's subjective view on the context. And then lastly, the second project also filled in the gaps about the author's sort of personal beliefs on things. So the first project that I did focus on the extensions to STROBE, and it had two main objectives. First, to classify the changes made in the extensions, to identify strengths and weaknesses of the original STROBE checklist. This was done with a qualitative assessment. And second, to determine the prevalence and typology of the wording of endorsement by journals in fields related to the extensions, and this was a cross-sectional bibliometric study. So when I started, there were 13 extensions published at the time, so we looked at all 13 of them for the qualitative assessment, whereas for the bibliometric study, we only looked at 7 of them, so those in black on the left, and that's because the other 6 in blue, those had been published for less than a year at the time that I started the study, so I didn't want to bias results and say, okay, something was published yesterday, why isn't it widely endorsed? So we wanted to give the extension authors and journal editors some time to possibly endorse those. So for the qualitative assessment, essentially what an extension does, it'll take these sort of original 22 STROBE checklist items and will either propose changing of the wording of the original items, or it will expand it in some way and add more nuanced information. So we took each one of those individual additions and we coded them as field specific or not, meaning that it was either very nuanced information that was specific to that certain field. So for example, something that's very important for nutritional epidemiology, or it was something that was really just a general methodological tenet, and that really should be in STROBE and not an extension. So across these 13 different articles or extensions, we found 298 additions. Good news is that about 2/3 of them were field specific and very nuanced, but roughly a third were not, and many of these were redundant as well. So this could indicate a couple different things. Firstly, it's possible that STROBE may need to be updated. This is not rare for reporting guidelines. Both Consort and Prisma have been updated at least once since they've been published. Alternatively, it could also indicate difficult areas for authors to understand, areas where they might need more guidance on, and this is really important to take into account for any education efforts. So the second part of this looked at the bibliometric study, or was a bibliometric study. We looked at journals that were publishing observational studies in the 7 areas related to those 7 extensions in black on the left. And these were identified through PubMed's broad subject terms, which sort of loosely categorize a journal. So for example, in genetics or public health or rheumatology. We then screened those journals to make sure they're publishing in English, still currently publishing, and publishing a little bit prior to STROBE, so we had some baseline data. And then we further distilled the information. We ran some Medline search strategies. So to make sure that these journals were actually publishing observational studies and observational studies that were actually relevant to the extension. And so we screened abstracts for those. So once we had our final journal pool, we extracted data from the journal website, so not just their instructions to authors, but also if they had anything about their ethics or their editorial policies, anything on the journal website. And we extracted information about the endorsement of STROBE, the relevant extension, Consort and Prisma, ICMJE, any mention of the Committee on Publication Ethics, and the Equator Network. We did some general descriptives on that, and we also looked into the relationship between STROBE endorsement and the other guidelines, Consort and Prisma, and its relationship to impact factor. So what we found was 310 sort of opportunities for journals to endorse an extension. So there was some overlap in between fields. So for example, there's an extension on molecular epidemiology, but there's also one for infectious disease molecular epidemiology. So conceivably, a journal could, promote both of those extensions if they publish relevant articles. And we found that unfortunately, less than 1% were requiring a relevant extension, and less than 1% were suggesting its use. So for extensions, the scene there is not great. For STROBE, we found 257 unique journals, and we found that over half did not mention STROBE in any manner, but 5% did require it, and 9% suggested authors to use it. A little bit strangely, roughly a third sort of mentioned the idea of reporting guidelines either directly by promoting the ICMJE recommendations, which do say explicitly, you should use reporting guidelines, and it does mention STROBE and Consort in it. So journals are sort of there on paper pretending like they are promoting these ideals, but when it comes to the actual reality of explicitly including these things in authors' instructions, there's a gap there. And for impact factor, we found that contrary to some other studies, that STROBE endorsement was not associated with any journal impact factor indices. But we did find that it was associated with Consort and Prisma endorsement, meaning that these sort of good practices come as a package. and that opens an opportunity for these groups to work together, perhaps. So the takeaways from this first project, first would be the qualitative assessment identified areas that might need to be added to the STROBE checklist, and also the educational intervention, and possibly identified items which aren't clearly communicated or may be insufficiently described. The bibliometric study established low endorsement rates for STROBE, but it's consistent with the literature out there. And it also established pretty much non-existent endorsement for extensions, unfortunately. And the sort of typology of endorsement, so those 5 different categories of requiring and suggesting, relevant guidelines, ICMGE recommendations, that highlights that some of the literature might be oversimplifying endorsement. There could be a big difference between requiring a checklist and suggesting it. And so it's very important to take into these nuances, to take them into account for any assessments on completeness of reporting in the future. And I should mention that all the data sets for this project are open source, so hopefully paired with all the endorsement information that we collected, that we will be able to explore STROBE's impact on completeness of reporting. And so whereas the first project sort of looked into the more objective point of view of what the academic publishing environment was like, the second project looked at the more subjective bit and asked authors using an online survey. And its overall objective was to assess researchers' attitudes towards and experiences with STROBE. And I recruited them through several different ways. So I was interested in authors of observational studies within the past 10 years. And so from the first study, when I ran those Medline search strategies, we had many abstracts. So these were authors of observational studies. So we scraped the corresponding author emails from those and sent over 16,000 emails. We also contacted the journal editorial offices, so 257 of those, and asked them to invite their authors through any ways that they had, like a listserv or a LinkedIn group or Twitter. And I also used my own social media and personal network to recruit people. So this is what the survey actually looked like. So obviously I asked them their informed consent first. And then there was a branching question that asked them about their level of awareness and use of STROBE. So I wanted to sort of capture as broad of perspectives as possible and not try to leave anyone out. So the first branch on the left would be those that when I sent the survey invitation, they had never heard of STROBE, and accordingly they've never used it. So first we introduced them to STROBE, the idea behind it that is promoted by some journals, and gave them some links if they wanted to learn more about it. And then asked them sort of what their gut impression of it was, what would motivate them to use it, and how they could see it working in their workflow. The second group in the middle would be those that were aware that STROBE existed when they got the survey invitation, but for some reason or another, they just haven't used STROBE. So asking them similar questions about what would motivate you to use it, but also, what made you first aware of it in the first place. And then lastly, on the right, and perhaps most obviously, those who they were aware that STROBE existed and they've also used it. So asking them, what motivates you currently to use it, and how often you use it. And then all the groups were asked sort of the standard set of questions on their beliefs, influences, and facilitators. This comes from the UTaught scale, which I'll cover in a second. And then they were asked their general demographics and given the opportunity to answer an open-ended qualitative question. So those green boxes, the standard set of questions that every group answered, comes from the Unified Theory of Acceptance and Use of Technology scale, or UTaught. So this is an instrument that's used in the field of health technology assessment, or HTA. And this has been used many, many times to evaluate different pieces of technology. So for example, software applications, mobile apps, any different type of tech, basically. And so this looks at what are the predictors behind one's behavioral intention to use this this piece of technology in the future. In this case, we're treating strobe as that. And so it's saying that there are 4 sort of key latent factors that influence one's likelihood to use this product in the future. And that's, so first, it's what expectations do they have in terms of the impact on performance, what expectations they have in terms of how much effort it's going to use or require, what sort of social influences that would that influence their likelihood to use this this device or strobe in this case, and what facilitating conditions they are. So some examples so you have a better idea of what I asked. So we modified these for strobe, obviously. So from the performance expectancy scale, something like using strobe enables me to write papers more quickly. Second, effort expectancy. I think strobe's content is clear and understandable. Social influence. My peers think that I should use strobe. And lastly, in general, I think that journals support the use of strobe. So in the end, our participants, we had nearly 1,300 who were eligible to participate in the end, and over 1,000 completed the entire survey, so that was over 80%. And we had a split between those 3 different branches of 20%, 20%, 60%. It's a bit anticipated that if you get a survey about something that you have interested in and yet you've used before, that you might be more likely to complete that survey. But we should note that nearly 200 people never heard of strobe before and were introduced to it. So in a way, it's a bit of an educational intervention itself to engage those people. And lastly, we had 150 people who responded to that qualitative question at the end. So for the methods, we obviously did the general descriptives on things like what made them first aware of it, what would motivate them to use it. And we also ran a confirmatory factor analysis on the scale itself, and also did a qualitative analysis of that open-ended question. So the CFA did validate the scale in a reporting guidelines setting. We had to do some modifications to it slightly, which is totally normal with these sorts of things. But it's good that it did validate the scale in a reporting guideline setting, meaning that it can be used and adapted to evaluate other reporting guidelines in the future. We found that a majority of our participants, who do currently use strobe, they use it during the reporting stage at the end of things, but that many do see value in using it earlier, during the study design part of things and when they're developing their protocols. This is very good because it opens avenues up for early intervention efforts. We also found that journals are the strongest motivator for authors to use strobe. It's usually how they were first made aware of its existence, and it's the one that's enforcing the use of strobe. And overall, that participants thought that it does take extra time to complete strobe, but largely that it's worth it because they see some increases in quality and they have some benefits from using it. So this is the qualitative question that was asked at the end. It was optional, very open-ended. So asking, do you have any other comments? Please feel free to expand on anything related to strobe or this survey, your experiences, thoughts on its usefulness, content format extensions. So a very, very broad question. And from this, we had 4 main themes. And so first would be the perceptions of the checklist, so both positive and negative. Second, this idea of academic confidence and self-assuredness. This is often expressed by more established researchers. Third, the current use in education and training with early career researchers. And lastly, the endorsement by journals and the use of strobe in peer review. So first, starting off with the good, this is sort of exactly what you want to hear, in that this participant thinks that strobe helps in standardizing how research is reported and guides the author or researcher to ensure that all the necessary information that the reader would be looking for is included, So that's sort of your best case scenario there. But unfortunately, not everyone was so positive about it. Quite a few participants did say that STROBE sort of restricts their ability to be creative in their writing. Some even saying that it's a procedural straitjacket and that it's very rigid. And I think that this is something that we need to communicate better, that just because it's a checklist doesn't mean that it's extremely structured and it doesn't require you to write in a certain way. So communicating the flexibility of STROBE, I think, is important to consider. So the next theme of academic confidence was interesting. There were several participants that they claimed that they sort of already apply the STROBE recommendations despite not having heard of it until they participated in the survey, which is a bit strange when you stop and think about it, because while STROBE does promote this overall ideal of research transparency and complete reporting, it is a physical tool. It is a checklist that does need to be completed. So there's some sort of disconnect there that we need to address. Also that quite a few researchers said that sort of in light of their training as trained epidemiologists, that they think that STROBE is a waste of time. So on this note, I wanted to talk about sort of this book called The Checklist Manifesto. It's by Atul Gawande, who's a surgeon, and he talks about the use of surgical checklists and also checklists in other areas, specifically the use of checklists by pilots in the airline industry. So I think I don't think any of us are going on a plane anytime soon, but back in the olden days of January when things were normal, I think that if we walked by the cockpit of a plane and saw a pilot who was using a checklist, your immediate reaction probably will not be that you're afraid that that pilot doesn't know what they're doing. I think rather it would be the opposite, and that would be sort of more reassuring that they're making sure that that nothing is forgotten, that everything is there. And I think that's the same thing that we need to sort of communicate for STROBE. So this participant summed it up nicely. They said, even for those of us who've been researchers for many years, it's sometimes helpful to check a tool such as STROBE to ensure that we've included everything. So we need to talk more about how this is a cognitive safety net, how it's a life jacket and not a straitjacket. While there were some sort of cognitive barriers to use with later career researchers, a lot of people had very optimistic views on its use for early career researchers. This participant thought it was exceptionally useful for them, and it can help them structure their drafts and develop a strong foundation in habits as they write their first papers. And they are already using it in their epidemiologic analysis course, and they hope that students continue to use it. So that's great to hear, and it's good that early career researchers are given this opportunity. The last theme of journal endorsement and peer review. So for early career researchers, it can give them the confidence to request the reporting of a certain piece of information, knowing that they have the backing of STROBE, so that's very good. But some participants saw it sort of as administrative busy work that's asked at the end of their whole process, and that when they are submitting it, that they're not getting any pushback or feedback on it. So they're saying that the information provided, nothing happens with it because the peer reviewers don't know what to do with it, and no one's sort of looking at it. And several participants sort of questioned whether it's even fair to ask peer reviewers to evaluate this when they're already looking at the manuscript and all of the supplemental files, and they're doing it for free. And lastly, similar to the quantitative results on the importance of journals, that authors really think that the main way to increase the use of STROBE is to make it mandatory before submission, and that guidelines should need to be obligatory for every study, and we need better implementation. So from both of these projects, some key takeaways that I think influence the creation of this educational intervention. So first, that it should encompass nuanced information from the STROBE extensions, They cover a lot of different fields, and so to completely ignore that information might not be the best. And also, whereas, I didn't work in a certain field, if I saw something from that checklist, sometimes it could spark something in my mind that there is some sort of parallel in my field. And I think that sort of the opportunity for extensions to learn from each other, is not really given its due attention. Secondly, in addition to accommodating this wide variety of fields and methodologies, that it should also try to include different schools of thought. So some participants talked about how they would like to see more of an emphasis on causal thinking involved, perhaps promoting the idea of suggesting something like directed acyclic graphs or DAGs in STROBE, so to visually represent the different factors that are involved in your study. Third, that it should be easily modifiable, especially if STROBE does need to be updated soon. And it needs to be easily accessed by a global audience. Our participants did come from all over the world. While it was in English, we did have a decent representation in that regard. And also epidemiology is a rapidly developing field, with new methodologies coming out all the time. So I think it's important to allow those methods to be shared more easily. Fourth, that it needs to be adaptable to diverse audiences, but recognizing that there might be more benefit for early career researchers. It's currently being used by some in that regard, and there are less cognitive barriers to overcome. Fifth, that it shouldn't intrude upon current workflow processes, meaning that the authors were saying that it does take extra time to complete STROBE. So doing anything that's going to build onto that and add extra time might not be super successful. And lastly, that the authors, they really think that journals are key to this. They're the motivators, they're the drivers of everything. But unfortunately, based on what's currently out there, to only rely on that end of things might not be very successful. So that leads me to my proposal for the educational intervention. So this is a public open source repository for epidemiological research methods and reporting skills for observational studies. So it was sort of influenced by the Epi-Twitter community and a few other sources. And it's great because there's a lot of people who are sharing both their work and others, new methods that are out there, and also communicating things in really innovative and user-friendly ways. But it's very hard to sort of keep track of this information. So hopefully this site could serve as sort of a hub for some of this knowledge sharing. So it's built using R and R Markdown. It's completely open source and hosted on GitHub, so anyone can propose edits to the text that way or to the site. So it starts with a sort of general introduction to the purpose of the site and observational studies and what STROBE is, and then it follows the format of the STROBE checklist. So it starts with the checklist item. It will include also the non-specific information from the qualitative assessments, so those distilled. So after the official checklist item, there are additional suggestions of things that you could possibly consider reporting. Then next, there's sort of the standard text from the E&E. So that's just sort of put in there, linked appropriately. And then after that, then there's the field-specific guidance. So the qualitative assessment that had all the extensions in it. And then at the end of each section, there's all the resources that were cited on that page, but it also gives you an opportunity to suggest new ones, to post your own there if you would like. So this site has a few different functionalities. Most easily, you can change how it looks if you don't like it. You can change the font size, font type, and the theme. You can also search the book if you'd like. And if you don't know R or R Markdown, you can simply sort of comment on the end saying, you know, either something like, oh, there's a typo here, or like, hey, I published this article on this topic. I think it'd be very helpful. And then all this information is included in a bib file, or a bibliography file that you can download. So you sort of have your own epi library, and you can use it in EndNote or Zotero or Mendeley. And at the end, there's also some resources for general stuff, so epi books, writing resources, teaching resources, statistics, and coding. Like I mentioned, it is hosted publicly on GitHub. I launched it, I think, back in February on Twitter. The view is blocking it right now. But yeah, I think there was decent impressions and engagements. If anyone knows anything about Twitter stuff, I'd be happy to talk to you about that. And then the one on the bottom is the output from Bookdown, which is where the book is hosted. And that was pulled sort of early May. So it seems like we've had some decent engagement with it. And lastly, you might be questioning right now, sort of, okay, well, how does this go with the workflow things or the time concerns? So the very first MiRoR meeting that I showed up to, you know, I had this idea for an add-in for Microsoft Word, and I had the whole projects laid out, and then I found out someone was already doing it. So rather than try to compete with anything, I reached out to her and we collaborated. So she's a PhD student at the University of Ghent, and she works with a team on the nutritional epidemiology statement. And so we collaborated on a randomized controlled trial. So they developed this add-in for Word. So it sort of just adds as a new tab there. And so then you can tag the text while you're writing, and it will automatically add to a reporting guideline checklist at the end of the document. And in addition, the E&E, the STROBE E&E information is there as well. So sort of if my proposal for the educational intervention is okay, then we can explore how we can sort of you know, embed that within the writing process more easily. So just as simple as doing something like, you know, for more information on this item, you know, click out to the website. And so with that, I wanted to thank everyone involved, the MiRoR network over the last few years. It's really been a spectacular experience. Specifically, I wanted to thank my supervisors and my mentor, Darko, Lupe, Isabel, and Liz, and also to thank all the students that are involved. They're really a fantastic group of people. And of course, my family and friends for supporting me. And I will end there and open it up for questions. So I welcome any feedback that you have. Thanks.